Thanks. Dr. Jah, how frequently is the president being examined by a physician in person?
Well, so the president's people are interacting with the president all day through Zoom and stuff. Dr. O'Connor has been seeing him on a regular basis. I think, I don't have an exact number of times that he saw him yesterday or today, but multiple times a day, either by phone call, by Zoom, physically examining him. But the president's doing really well, so he doesn't need an ongoing, exam all the time. And obviously he's getting examined at least once a day. But Dr. O'Connor is interacting with the president on a regular basis.
And has the president been examined by any other physicians beyond Dr. O'Connor?
Physically examined? I've spoken to him by FaceTime. Not that I know of. Not that I know of.
Was there a discussion about the possibility that eliminating the blood thinner, even for just 5 days, would increase the risk of stroke because he's on chronic atrial fibrillation?
Yeah, so we, by the way, clinically do this a lot. I can't remember, probably thousands of patients that I have taken care of over the years in the hospital who come in, who need a procedure, who are on blood thinners like Eliquis or other blood thinners that we stop for short periods of time where people get procedures. They stop it because he's obviously stopped it because he's on Paxlovid. For atrial fibrillation, we think this is a relatively low-risk thing to do. But Dr. O'Connor, as was part of the plan, has been consulting with experts around the country. And based on input that he got, he made the decision to give the president a short course of aspirin during that time.
So this was a discussion that took place whether or not to go with Paxlovid over, say, a monoclonal antibody?
That decision was made by Dr. O'Connor. Paxlovid is the first-line agent that we recommend. That was the decision that Dr. O'Connor made. And then we know that you have to look at somebody's medication list and determine, do you have to make modifications? Dr. O'Connor made the decision to stop these two medicines. I talked about those are very reasonable. That's what all the specialty societies recommend, that they be paused. And so then Dr. O'Connor made the decision to add aspirin for a short period of time.
Dr. O'Connor also said that the president's using an inhaler as needed. Does he regularly use an albuterol inhaler, or is this something that was prescribed just to deal with the COVID symptoms?
Yeah, so I think all of you know, because it's been disclosed for years, the president used to have asthma. He has what people talk about as reactive airway disease, which is people often, when they have a viral syndrome, or some people get it when they go out in the cold, or some people get it when they exercise, can get a little bit of bronchospasm or a cough. The way to treat it is with an inhaler. So the president, last time he used it before this illness was when he had a cold, I think last fall at some point. During that cold, he also had a little bit of cough that comes with viral syndromes and used it. So he does not use it on a regular basis. It's not part of his regular medications, but in the context of a viral syndrome.
You've been credited